A young man walks into the clinic for what he believes is a routine blood test. He isn't sick, he isn't coughing, he doesn't have a fever, he exercises regularly, he goes to work every day, he feels completely healthy. A few days later, his phone rings. Hello, this is the clinic. Your results are ready. We did like you to come in today. He isn't worried, he assumes everything is normal. Moments later, the doctor gently says, you are HIV positive. His heart races, the room suddenly feels silent. His mind fills with questions. Does this mean I'm going to die? Can I ever get married? Can I have children? Will people know just by looking at me? These are questions thousands of people ask every day. But here's something many people don't realize. The story of HIV is very different from what it was decades ago. Modern medicine has transformed HIV from what was once almost always a fatal disease into a condition that many people can successfully manage with long life treatment. People living with HIV can work, they can have families, they can have long, fulfilling lives with appropriate medication. So, what exactly is HIV? How does it attack the immune system? Why can someone live with HIV for years without knowing? What's the difference between HIV and AIDS? And what does undetectable equals untransmittable actually mean? Stay with me because today we are separating the myths from medical facts. Welcome, hello everyone. Welcome back to my channel. I'm Dr. Aminat and this is a trusted home for evidence-based medical education where we simplify medicine and empower healthier lives. If you're passionate about learning reliable health information that's easy to understand, you are in the right place. Please subscribe and turn on the notification button. Every week we explore important medical topics that could help you or someone you love. So today's topic is one of the most misunderstood diseases in medicine, human immunodeficiency virus or HIV. Let's begin. So what is HIV? Imagine your immune system has an army protecting your body every single day, and millions of specialized cells constantly search for viruses, bacteria, fungi, and other harmful organisms. And one of the most important soldiers in their army is called the CD4 T cell, also known as a helper T cell. Instead of attacking these soldiers directly, HIV infects them. The virus enters these cells, uses their machinery to make copies of itself, and over time destroys many of them. As more CD4 cells are lost, the immune system becomes weaker. That means infection and illness that a healthy human system would normally control can become much harder to fight. This is why HIV targets the immune system rather than just one organ. So how is HIV spread? HIV is spread when certain body fluids from a person with HIV enters the bloodstream or the mucous membrane of another person. Examples include the blood, semen, vaginal fluid, rectal fluid, breast milk. Common ways that HIV can be transmitted includes unprotected sexual contact, sharing needles or syringes, transmission from mother to baby during pregnancy, birth or breastfeeding, and exposure through contaminated blood products in places where blood screening is inadequate. However, many everyday activities do not spread HIV. So how does HIV not spread? This is one of the most important sections of today's video. You can't get HIV from hugging, shaking hands, sharing food, sharing toilets, mosquito bites, sweats, tears, casual social contact. These myths have caused unnecessary fear and stigma for many years. Understanding the facts help us support people living with HIV with compassion rather than misinformation. So what happens after infection? Okay, what happens after infection? After HIV enters the body, some people may experience an early illness within a few weeks. This can include symptoms such as fever, sore throat, a rash, a swollen lymph node that is swelling around the neck or in the armpit or in the groin area, muscle aches or fatigue. These symptoms are not unique to HIV and can resemble other viral infections. So many people have no noticeable symptoms at all. So after this early phase, HIV may continue to damage the immune system quietly over several years if it is not treated. This is one of the reasons testing is important. So how do we differentiate HIV from AIDS? So many people think HIV and AIDS are the same thing. They are not. HIV is the virus. AIDS is the most advanced stage of untreated HIV infection. Okay, so when the immune system has become severely weakened and certain serious infections or illness can occur because of this. Because the immune system has been weakened, then a lot of illness could occur. With modern treatment, many people diagnosed with HIV today never develop AIDS. So that's why it's good to test. So now let's go to HIV testing. The only way you know if you have HIV is to get tested. Healthcare providers may recommend different types of tests depending on the situation, including laboratory blood tests and rapid tests. Testing is especially important after a possible exposure or if you have symptoms that concern you. Early diagnosis allows treatment to begin sooner, improving long-term health. Okay? Now, how do we treat HIV? So the HIV is treated with medicines called Antiretroviral Therapy, often shortened to ART. These medicines work by stopping HIV from making copies of itself. Although ART does not remove HIV from the body, taking treatments as prescribed can lower the amount of virus in the blood to very low levels. And this helps to protect the immune system and greatly improve long-term health. So what does undetectable equals untransmittable means? I remember I talked about this previously. And this means that you may have heard the phrase before. This means that when a person with HIV takes effective antiretroviral therapy and maintains an undetectable viral load, they do not sexually transmit HIV to their partners, according to current scientific evidence. This is one of the most important advances in HIV medicine and highlights why access to treatment is so important. That is why you need to get treated. But remember, prevention is better than what? Cure. So, how do we prevent HIV? Preventing HIV involves several proven strategies. These include using condoms correctly and consistently, never sharing needles or syringes, considering PrEP, which is medicine taken before possible exposure for people at higher risk. So using a PEP, which is emergency medicine that should be started as soon as possible, ideally within 72 hours after a potential exposure. Regular HIV testing also plays an important role. So, how about HIV and pregnancy? People living with HIV can have healthy pregnancies with appropriate medical care and treatment. The risk of passing HIV to the baby can be greatly reduced. And if you're pregnant and have HIV or think you may have been exposed, speak with your healthcare team as early as possible so they can recommend the most appropriate care. So now let's separate the myths from the facts, okay? So one myth we have is HIV always causes symptoms immediately. That's false. Many people feel completely well for years, okay, without even having symptoms. Another myth is HIV can spread through organ. That is false because casual contact does not spread HIV. Another myth, HIV and AIDS are the same thing. That is false because, as I've explained earlier, HIV is the virus and AIDS is the most advanced stage of untreated HIV infection. Another myth is people with HIV cannot live long life. That is really false and we should stop spreading that because with appropriate treatment, many people live long, active lives. Now, if there's one message I want you to remember today, it is knowledge changes lives. Fear grows in silence. Facts replace fear. HIV is a medical condition, not a measure of someone's worth. Early testing, timely treatment, and compassion makes a real difference. If you think you may have been exposed to HIV or have concerns about your health, speak with a qualified healthcare professional and consider getting tested. The sooner HIV is diagnosed, the sooner treatment can begin. Thank you so much for watching. And if you found this video helpful, please like, subscribe, and share it with someone who could benefit from it. I am Dr. Aminat, and remember, knowledge saves lives. Prevention protects future. Stay informed, stay healthy, and I will see you in my next video.